My name is Anushka Kabra, and what I worked on throughout my summer and my project this year focused on bridging policy and prevention and advancing sexual and reproductive health and rights to end child marriages. So the avenues in which these initiatives can be used in that process. A little bit about me. I'm a rising senior at Doherty Valley High School. I'm an avid congressional debater and student journalist. So I use those platforms and forums to kind of advance health equity in my home county of Contra Costa County. I'm also very passionate about equity through my experience globally with my work as a national youth lead at ACOM USA, which is a nonprofit that supports the underprivileged in India and allows them to build sustainable gardens and other community initiatives such as prenatal care classes and etc. Now I'm working with Dr. Ndola Prata and Bhavya Joshi at the UC Berkeley campus, along with all of the other interns that we just had up here. Something a little bit about my own project had two prongs. Essentially, the first prong, I analyzed literature and created infographics on the state of sexual and reproductive health. So this was a literature review on the global state in low and middle income countries, also known as LMICs. What I did further was authored a policy brief with recommendations to prioritize sexual and reproductive health and rights. So to address key issues in its barriers to access, including funding, withdrawals, lack of legal protections, and health access that was being denied to a lot of young girls across the globe. So essentially my work and research throughout this presentation and throughout this project aim to inform advocacy, funding, and legislative reform to protect these girls against health complications and inequities that came with child marriage. So for the first part, again, as I mentioned, I made these infographics that focused on sexual health and education first off. So starting off with this one, I essentially took many statistics that are relevant to the global state, and one particularly alarming finding stood out to me, that over 130,000 women lose access to contraceptives daily due to the current state of US funding cuts to international assistance in family planning. Even further, that's at a time where less than 1 in 3 girls aged 15 to 24 have comprehensive knowledge about HIV and other sexually transmitted diseases. So millions of young girls are left behind in access to comprehensive sexuality education, also known as CSE. And as you can see, you can take a picture of the QR code in case you want to access these infographics. The next one focused on the global state of reproductive and health and rights. So in this one, what stood out to me particularly between 2016 and 2020, there was no global reduction in maternity mortality rates, which is a chilling reflection on how much SRHR has actually been deprioritized in the current state of our globe. In fact, research shows that just a 10% reduction in child marriage could lead to a 70% drop in maternal deaths, benefiting children, mothers, communities, and future generations. So if you want more information about that, you can also take a look there. What I did next was brought this research together into a policy brief that I authored by myself and analyzing barriers and progress in low LMICs such as Kenya, Mozambique, Ghana, Peru, and Guatemala, as well as Nepal. So I analyzed how different SRHR initiatives in a bunch of these countries played out, what barriers to access looked like in these countries, what worked and what didn't. So I wanted to go into a couple of my key recommendations. You can read the full thing again at this link if you'd like. But some of my policy recommendations going through each key stakeholder started with national governments. And for them, the main thing was integrating SRHR into universal healthcare coverage, passing legal protections aligned with global human rights frameworks, and dedicating 10% of their national development budgets to SRHR. Also, to mandate comprehensive sexuality education in their national schools. Furthermore, for the UN and other international aid organizations, I recommended defending SRHR norms and rights. So using those international frameworks that have already been created and already in place to enforce some of these laws in these countries where weak legal protections don't allow them to be. And furthermore, I asked international organizations to provide technical data tools and training, especially in a lot of these countries that lack the initiative or the resources to actually do data collection on child marriage and the impact on these young girls, to further emphasize how much policy action needs to be done in these countries. And even further, I recommended they collect data to monitor their targets and to hold countries accountable for their progress in sexual and reproductive health. Next, for private donors and philanthropic organizations. So an example of this would be the Bill and Melinda Gates Foundation. And especially in the current state where countries are defunding sexual and reproductive health, even the United States has done so in the status quo, it's more important for these private donors to support diverse, long-term, and flexible funding systems. So for example, supporting grassroots SRHR funding systems and ensuring that these new organizations have ways to thrive and ways to provide these initiatives to young girls. Even further, to fund intersectional programs that reach the most marginalized youth, especially those in countries with humanitarian crises, because those are the people that lack access to care the most. And then finally, to support peer education, male allyship, and other successful models that have worked in countries like Kenya and Mozambique, and expand them to other countries. Finally, for civil society organizations and nonprofit organizations, combining grassroots organizing like that private donors have funded in the past, and then combining them with digital strategies, as there is an untapped potential for digital media in this field, as well as expanding the access to sexual education and reproductive education. Also, to create referral systems for survivors of child marriage or people who are struggling with initiatives to actually take the step and get legal protection or healthcare. And then finally, to push for legal reform in coalitions. So with civil society organizations partnering up with the UN and other international organizations to continue to fight for the rights of these young women, to push back against the factors that lead to child marriage. So throughout this project, I learned definitely a lot, as child marriage is a broad topic, but what I learned the most was that there's so much limited research on child marriage in conflict affected and marginalized communities, because most people don't really look into the prevalence or the outcomes of child marriage, what it's doing to young girls' health and what it's doing to their mental health, especially. There's also so much weak enforcement of laws, because even though they are in place in most countries, like for example, not marrying before the age of 18, there's a lack of resources within the authority figures in that state or country. And so then not a lot of them enforced, and more girls are forced into child marriage. And then finally, I looked at overlooked outcomes of this, including child health, mental health, intimate partner violence, which is huge in young girls married under the age of 15, and marriage termination, to understand the true impacts of child marriage on these young girls. And then finally, again, as I mentioned earlier, for civil society organizations and the untapped potential of digital media for delivering that comprehensive sexual education, whether it be contraceptive use or other methods that actually encourage these young girls. So for a discussion and reflection of my total experience in this internship, I definitely expanded my understanding of the current state of global health, whether that be from infectious disease to reproductive care. Some talks that stood out to me the most were Dr. Dondu's and Mr. Porter Delaney's on the current state of global health, how funding cuts are working, and how advocacy groups are working against that and actually trying to secure more funding for global health and secure initiatives that are already in place. I also gained through Sun's invaluable professional talks about skills in networking, informational interviews, and career exploration. The weekly seminars with leaders in the field reinforced the value of culturally competent and community-based solutions. As Lammy mentioned in his recent lectures, I really understand the impact of colonialism and other factors on what the state of global health care looks like today and how to be culturally competent while doing it. So for the closing, I'm preparing to apply to college as a public health and/or global health major. I'm eager to build on a lot of the research skills and analytic skills that I've gained throughout this experience, doing my research on child marriage and also the state of SRHR, and channel them into a future in global health advocacy and public policy. So hopefully something like an MD, MPH in the future. I will be furthering my involvement with health policy as an intern for the Contra Costa Health Department in the future, and I hope to continue. I'd just like to do a quick shout out to Dr. Prada, Bhavya Joshi, and all of the other UC Berkeley interns, Divya, Asha, Mihika, and Jennifer for their support throughout the internship, as well as Chris, Lammy's son, Dr. Dondu, Azul, Max, Stephanie, and the entire team that made this experience so educational and inspiring for my future. And these are my references.